Well, in our center we use Perceval as our valve of choice for a wide category of patients, because Perceval offers on patients to have a very smooth and fast operation, and you can position the valve with minimal manipulation in the aorta. So we see very good outcomes in terms of early risk. We see a very good early survival, we see low events of stroke rates, low events of early dialysis need. And this is why we use it in both in isolated aortic valve replacement, done minimally invasive, as in more complex procedures. Why are we still using it after 14 years? This is because we see a great long-term outcome. We have now more than 1,000 patients with a follow-up of more than 14 years. We see very low rates of valve degeneration, very low rates of need for reoperation, and this is why we are still using it. Well, the whole world of aortic valve disease certainly has changed, because we have seen the advent of so many new techniques, like the transcatheter techniques, for example, which are invading heavily in the whole field. But with Perceval, I think you have the possibility in, for example, in single valve disease to do very straightforward, simple, minimally invasive procedures, either through mini sternotomy or through right anterior thoracotomy. And this has certainly been a major advantage, having the combination of minimally invasive surgery and the sutureless valve technology like Perceval. I can only recommend to all young surgeons to look for a way to get in touch, to have their hands on this sutureless technology. Because like I say, if we want to keep the surgical field alive and to keep on providing high quality of treatment for aortic valve disease, a surgeon needs to be able to deliver this kind of sutureless valves to his patients as well. Young surgeons who do this for the very first time certainly need a guided implantation in the first 2 or 3 operations, so they certainly need a proctored guided operation for their first experiences. It is really thanks to the industry and to valve manufacturers like Corsim that they are introducing new tissue treatments and new tissue technology onto their valves. The whole world and many patients are asking for more and more tissue valves, even at a younger age. So it is critical that we can provide them with tissue valves that are durable and that are able to withstand calcification on the long run. With Perceval Plus, Corsim really introduces a new tissue treatment aiming at longer durability and longevity of the tissue valves. With recent prospective randomized trials, for example, like with the PERSIST trial, Perceval have certainly proven that they are a valid alternative, and even in minimally invasive surgery, even to be superior to standard sutured tissue valves. So this is no longer an issue. Perceval is certainly as valid and in some cases even superior to standard sutured valves. With regard to the comparison to transcatheter techniques, these transcatheter techniques have also not proven yet their validity in a wide range of patients, certainly not in the low-risk patients and certainly not in the long-term follow-up. So also the transcatheter technology still has many things to prove.